Electrolyte balance implies that the rates of losses and gains of each electrolyte in the body to be equal. Electrolyte concentration directly affects water balance, and concentrations of individual electrolytes affect cell function. So if we look at some of the major electrolytes, one of them being sodium, it is a dominant cation, which means it is positive charged in the extracellular fluid. And sodium salts provide 90% of the extracellular fluid osmotic concentration. So you have sodium in the form of sodium chloride, NaCl, and also sodium bicarbonate, NaCHO3. The normal sodium concentration in extracellular fluid is about 140, and in the intracellular fluid it's about 10 or less. Potassium is the dominant cation in intracellular fluid, and normal potassium concentrations in the intracellular fluid is 160, and in extracellular fluid it's between 3.5 and 5.5. So you can see that the sodium outside of the cell is higher, and the potassium inside the cell is higher. So the rules of electrolyte balance. The most common problem with electrolyte balances are caused by an imbalance between gains and losses of sodium ions. This occurs quite commonly in people who are on lots of medications. Some people are on diuretics, and other people are unable to concentrate their sodium. Problems with potassium balance are less common but are more dangerous than sodium imbalances. The best way to rectify a sodium imbalance is to limit the amount of fluid that the person takes in orally, and that will cause the sodium levels to rise. So the total amount of sodium in the extracellular fluid represents a balance between two factors: sodium ion uptake from the digestive epithelium and sodium ion excretion in urine and perspiration. Large changes in extracellular fluid volume can be corrected by homeostatic mechanisms that regulate blood volume and pressure. So if the extracellular fluid volume rises, blood volume also goes up. If the extracellular fluid volume drops, blood volume goes down. So here is a diagram which shows you how the body maintains homeostasis. So we're at the bottom of the diagram where the red arrow says start. So homeostasis, where the body is in balance, normal amount of sodium concentration in the extracellular fluid. Then we move following the arrow to the left. There is a disturbance in homeostasis resulting in an increase in sodium levels in the extracellular fluid. This increase causes the osmoreceptors in the hypothalamus in the brain to be stimulated. They are stimulated and they cause the secretion of antidiuretic hormone. The secretion of antidiuretic hormone acts on the kidneys to restrict water loss and also to stimulate behavior change by water-seeking behavior and promoting the additional consumption of water. So the recall of fluids, because of the extracellular fluid osmolarity increases, water shifts out of the intracellular environment, increasing the extracellular volume and lowering the sodium concentration. Now homeostasis is now restored, and we have a decrease in sodium and the levels are back to normal. So now what happens if there is a decrease in sodium? So here we're starting at the top of the diagram with the red arrow. So we have homeostasis currently, normal sodium concentration in extracellular fluid. Then we move to the arrow to the left where the homeostasis is disturbed and there is a loss of sodium from the extracellular fluid. Again, the osmoreceptors in the hypothalamus are inhibited and antidiuretic hormone secretion decreases. As soon as the osmotic concentration in extracellular fluid drops by 2% or more, antidiuretic hormone secretion decreases. So thirst is suppressed and water losses in the kidney increases. And that means that there is a net loss of water, and water loss is reduced in the extracellular volume and the ions become more concentrated. That means that there will be an increase in sodium ion levels in the extracellular fluid. Homeostasis is again restored. So, as we said before, the homeostatic mechanisms: a rise in blood volume elevates blood pressure. A drop in blood volume lowers blood pressure. Monitoring of the extracellular fluid indirectly by monitoring blood pressure. You can monitor blood pressure by the baroreceptors, baro meaning barometric pressure, baroreceptors in the carotid sinuses, in the carotid arteries, the aortic sinuses in the aorta, and the right atrium of the heart. We'll look at these in a few weeks when we look at the heart. Hyponatremia, which is common in the elderly, is when the body content of water rises through overhydration. They may be losing sodium through medications that they're on, and the extracellular fluid sodium concentration is less than 136. Remember, it should be about 140. So that drop of only 4 causes a state of hyponatremia. The opposite is where you have too much sodium and you have hypernatremia. The body water concentration declines, as in dehydration, and the extracellular sodium concentration is greater than 145. Remember, the level that we're looking for is 140 to maintain homeostasis. With the potassium balance, 98% of potassium in the human body is in the intracellular fluid. The cells expend energy to recover potassium ions diffused from the cytoplasm into the extracellular fluid. The process of potassium balance involves the rate of gain across the digestive epithelium and the rate of loss into urine. So potassium lost in the urine is regulated by the activities of the ion pumps. So the long distal portion of the nephron, which is part of the kidney, the collecting system. So sodium from the tubular fluid is exchanged for potassium in the peritubular fluid. And they're limited by the amount gained by absorption across the digestive system to about 50 to 100, or 1.9 to 5.8 grams per day. Factors in the tubular secretion of potassium: changes in potassium concentration in extracellular fluid, changes in pH or body acid levels and alkaline levels, and also another hormone called aldosterone. Changes in the concentration of potassium in an extracellular fluid. You have a higher concentration of extracellular fluid. Concentration causes an increased rate of secretion. Changes in pH. Low extracellular fluid pH lowers the peritubular fluid pH, and hydrogen rather than potassium is exchanged for sodium in the tubular fluid, and the rate of potassium secretion declines. Aldosterone level. Aldosterone is a hormone that's secreted, affects potassium losses in urine. The ion pump reabsorbs sodium from the filtrate in exchange for potassium from the peritubular fluid. High potassium plasma concentration stimulates aldosterone.